Yeah, I hope the rest are listening as much as we've not had them being able to introduce themselves, and I hope that there will be others joining. And just to welcome everybody to this meeting. Of course, it happens during an unprecedented time. One would have preferred to have had conducted it face to face, enjoyed some tea along with it, given that it's in Vihiga, a county which I'm very familiar with, and just to enjoy the company that would have gone along with the launch of the report. But I think for now, we just take this virtual convening as an opportunity to be able to launch and share the report. But I hope that Elizabeth will also be able to follow up with an official handover, just to seal this research piece and also set forward other engagements that may arise, or particularly in regard to the implementation of the recommendations. But really, I think on behalf of TIA Kenya, I just want to give a warm welcome to everyone, wish everyone a good afternoon, and relay greetings from all colleagues from TI Kenya, and just thank everyone who has joined so far and others who are planning to join us, and hope that the network will be favorable to everyone down there. And to also just take this opportunity to say that we are just pleased to meet everyone here today. And as I mentioned, due to the outbreak of the COVID-19 pandemic, we have really been forced to go outside the norm and adapt new ways of conducting activities and forums. And this is really one of the ways we are conducting our business. And just thanking everyone for the extra effort it takes to be able to come on board online to join this conversation. So I'm sure many of the participants, as I've had the introductions, are familiar with TI Kenya. Transparency International Kenya is a not-for-profit organization. We've been present in the country since 1999, and really our aim is to develop a transparent and corruption-free society through good governance and social justice. And our vision is a corruption-free Kenya, and our mission is to champion the fight against corruption by promoting integrity, transparency, and accountability at all levels, both national levels and county levels, individual levels, and institutional levels as well. And it's really the spirit behind the work that we then set off to do. So since October 2019, so exactly a year ago, we have been implementing a project which we call the Enhancing Service Delivery in the health and TVET sectors in Vihiga County. And we also conducted other counties such as Kiambu County, Machakos, Trans Nzoia, and Elgeyo Marakwet. And we have conducted this project in the other counties since 2015, but specifically in Vihiga since 2019, and actually just took over the project from a different organization, and we found that they had progressed and done some initial groundwork and just picked up to finalize this research work. And all this with the support of the German Development Corporation, that is JZ. So in essence, the project seeks to enhance service delivery in the health and TVET sectors by mainly empowering citizens and including them and empowering them also to participate in civilian oversight level engagements. And the project really presupposes that the numerous gaps and challenges that we have seen facing counties can be tackled effectively if citizens are adequately informed and also involved in the whole chain of public service delivery. So one key implementation strategy is to ensure citizens of this project is to ensure citizens are empowered to audit county services in the sectors that we are looking at, and follow through to ensure that the audit findings from this from these, the findings of this audit, social audit processes and recommendations are shared with stakeholders and implemented to improve service delivery in the county. So one part of this is, just sharing these recommendations, and then we'll pick it up and see how we can push forth for implementation of the recommendations that we have listed in the report that will be launched today. And you know that the Constitution of Kenya places an obligation on the state, both at the national and at the county levels, to put in place mechanisms, which include both legislative and policy measures to achieve the progressive realization of the right to health. But we've seen notable gains since the promulgation of the Constitution of Kenya in 2010, and particularly towards improving service delivery in the health sector. But there still exist numerous gaps that threaten the realization of the right to health, which is a very, very critical right. And citizen involvement and engagement towards promoting the right to health continues to be low. And we've particularly seen this being very prevalent during this COVID-19 period, where both national and county level, there have been efforts towards responding to the crisis, which primarily started as a health crisis. So citizen involvement and engagements towards promoting the right to health continues to be low. Availability of essential commodities, infrastructure, the challenge of corruption still remain critical gaps, and which greatly hinder the provision of health services. And it is therefore against this backdrop that TI Kenya sought to empower citizens through the social audits that we conducted, and then use these findings and recommendations to advocate and lobby for change towards better service delivery in the health sector. And that is really what led us to the social audit work, and then now this report that we aim to launch today. We really just want also to commend the efforts made by the county government of Vihiga, the efforts that they have taken towards building the health sector so far, and also for the cooperation that we got towards completion of this report. As I mentioned, it is work that started with another organization, but we've only come in last year just to finalize this piece of work. We also therefore want to appreciate the various stakeholders in the county who came out to support and support the social audit work, our development partners, GIZ, for giving us the technical and financial resources to be able to undertake this social audit, civil society organizations, and generally citizens for all the contributions that they have given and the support towards ensuring completion of this report. We trust that the report that we are launching today and the recommendations you will see therein, that this will provide useful points of reference for the county government and the various stakeholders working in the health sector to be able to address the gaps, particularly accountability gaps, and enhance service delivery in the sector. I really hope that by the end of this engagement today, we'll also have critical action points emanating from the recommendations that are outlined in this report, so that we can have a way forward, a roadmap towards improving service delivery and accountability in the health sector in Vihiga County. I really look forward to fruitful deliberations and a successful launch, and generally more engagement thereafter to breathe life into the recommendations that we have put forth in the report. Thank you very much, and we will be able to speak more during the launch of the report and in the rest of the program. Thank you, Asantini.
Thank you so much, Sheila, for the opening remarks. I would like now to go to Reverend Elisham. He's a representative from the Department of Health in Vihiga County. I'd like to invite him to introduce himself and also give his opening remarks. Welcome, Doctor.
Thank you very much, Liz. I want to appreciate TI for the initiative that they have done to come up to identify some of the gaps that exist in the health delivery in our county. I wish maybe before I say one or two things to introduce myself as Reverend Dr. Elisham Thomas Ambale. I work in the Department of Health. I coordinate public health activities in the county. And I want to thank you, Liz, for bringing us on board and actually conducting this exercise, which has had the purpose of identifying some of the gaps that exist in our health delivery system. Just as Masinde has mentioned, we are looking forward to this report that is being launched with an open mind, so that we can be able to look at those areas that have been highlighted in the report, with a view of also sharing with the health managers and the county government at large, so that we can be able to implement the gaps as much as we are able to do by the county government. And also this information can help us to seek for support from our partners who are working with us to improve health service delivery for our people. So on behalf of the Department of Health, I want to really appreciate TI for the work that has already been done. And I sit here to listen to the gaps that have been identified and the recommendations that have been put in place, which we'll objectively look at and avail ourselves to implementing. I also want to appreciate that I can see among the participants are members of the community who are actually key stakeholders, who are also bringing up issues that need our attention. And I want to make an assurance with the stakeholders that are there, that as a department, we will work hand in hand with them and both with the TI to put the recommendations that have been put forward in consideration, so that at the end of the day, quality health service delivery shall be the issue that we'll address as a department. So I want to once again say thank you very much for bringing me on board on behalf of the Department of Health. And I want to give an assurance that we'll do all that it takes to put in place the recommendations that are going a long way in improving the health of our people. Thank you very much and God bless.
Thank you so much, Doctor, for your opening remarks. We are grateful and we continue to thank the county government for the support that it has continuously given us in terms of coming up with this report, and also just in the review process of the report. I would like to go to our next item in the program, and that is just presenting a background of the project that we are carrying out right now and the social audit process. So allow me to share my presentation so that we can just follow through. Can you all see my screen? Can we all see my screen?
Yes.
Yes. Thank you so much. I'll quickly go through the presentation that we have today on the background of the project that we are carrying out, and also on the background of the social audit process. As had been mentioned earlier by the executive director, our organization has been implementing the Enhancing Service Delivery in the Health and TVET Sectors project in Vihiga County since October 2019, with the support of the German people through the German Development Corporation. So the goal of the project that we're implementing is to enhance service delivery in the health and TVET sectors through citizen empowerment and civilian oversight. Among the outcomes that we're expecting in implementing the project is strengthened capacities of citizens and county governments to engage in good governance and in the fight against corruption. We are also expecting to see an increase in the reporting and redress of corruption-related complaints and cases. So this project basically seeks to empower citizens to audit county services and follow through to ensure that the social audit findings and recommendations are implemented by the duty bearers. The project is also being implemented in Kiambu, Machakos, Uasin Gishu, and Elgeyo Marakwet counties, And this project in these counties, it is in different implementation phases. In Vihiga County, the project is in its initial stage and seeks to push for uptake of the recommendations of the social audit report that was conducted by Clarion with support from GIZ in 2018. So I'll go to the background of the social audit process, how the social audit process was undertaken, who conducted the social audit process, and what health facilities were audited, for us just to get to know how the process was undertaken. So this report that we are going to launch today is a report of the social audit exercise undertaken in various health facilities in Vihiga County to assess the level of service delivery in the health sector. So the report that we're going to launch today contains the findings and recommendations of the social audit exercise, and it is intended to push for uptake of the recommendations for better service delivery in the health sector. So the social audit process itself was undertaken in 2018 by the Center for Law and Research International, that is Clarion, with support from GIZ under their health sector program. However, the social audit process was not fully completed then, and these findings were never shared with and discussed widely with stakeholders. So TI Kenya, through its Enhancing Service Delivery in the Health and TVET Sectors project, and with support again from GIZ, we sought to review the social audit process and draft reports and use these findings to empower citizens to demand and advocate for better service delivery in the health sector. So in October 2019, that is last year, we did a review of the social audit process through engagements with various stakeholders, including medical and clinical officers in charge of various audited facilities. We also did the review with the social auditors who conducted the social audit process. And then the report was further subjected to a validation exercise during the same month. So this validation exercise brought on board the county executive, the county assembly, and also representatives from the community members. So as we speak now, the report has already been published and is ready to be shared and disseminated with various stakeholders, hence this launch. How was the social audit conducted? In undertaking the social audit process and coming up with the social audit report, both primary and secondary data were utilized. So the data was collected by a tool that was developed by Clarion then. And then the primary data consisted of information directly gathered from the institutions, personnel working in the institutions through key informants interviews, focus group discussions, and also observations. Those also secondary data that was utilized, that was desktop reviews on various laws, international instruments, county budget documents, among others. The facilities that were audited back then were the Vihiga County Referral Hospital. This is in Vihiga Sub-County, the Sabatia Sub-County Hospital in Sabatia Sub-County, Ipali Sub-County Hospital in Emuhaya, Hamisi Sub-County Hospital in Hamisi, Emuhaya Sub-County Hospital in Luanda, and Bale Rural Health and Training Center. So basically, that was in brief. That was the social the process that brought on board the findings and the recommendations that we have now. So I'll just proceed now to share the findings of this social audit process that was undertaken back then. So according to the findings of the report, one of the findings was on the staffing gaps in Vihiga County. According to the findings, the county had insufficient human resources for health across all the cadres. And critical to note was the lack of a pathologist for cancer diagnosis and an anesthesiologist for cardiac surgery cases in the entire county. So what the findings revealed was that service delivery was being hampered because of the staff shortages. The county cannot be able to effectively deliver because now we do not have some cadres to give services that are required in the county. Another finding was underfunding of the health sector and annual budgetary allocations. So this had contributed to limited implementation of projects and shortage of medical commodities. Additionally, the suspension of the Facility Improvement Fund for health facilities had affected efficiency and availability of essential services to the citizens. By the time we were doing the reviews, the FIF had been suspended. However, during this year, I think in May, the FIF bill was introduced back and it was assented to by the governor. So we also had a finding on health infrastructure that the health infrastructure in Vihiga County was insufficient. It revealed that the audit report revealed that despite numerous efforts by the county to put in place adequate infrastructure, most of the health facilities lack sufficient infrastructure like specific wards for children, consultation rooms, adult, male and female wards, incinerators, adequate sanitation facilities, among others. There was also a finding on the management committees. So whereas all the facilities had management committees in place, there existed capacity gaps among the members of the committees in terms of discharging their duties. There was also a disconnect between the management committees and the community members, with the majority of the latter having no knowledge of who they were and what their role was in promoting service delivery in the health sector. So on complaints and compliment handling, all the facilities visited had suggestion boxes and other mechanisms of handling complaints and compliments, like direct communication with the facilities and public barazas. However, it was noted that these mechanisms were not as effective as they should be. Majority of the respondents indicated gaps in the management of the complaint boxes, particularly on who manages them, the frequency in which they are checked, and the feedback mechanism to the complaints or compliments. So there was also lack of effective public participation in the health sector generally. So the findings reveal that majority of the citizens had no knowledge of the processes in the health sector and had very little involvement in the decision-making processes on matters health, thereby curtailing their efforts to provide oversight. So on service charters, all the facilities visited had service charters. However, most of them were not updated and had no information on the charges for the services offered by the facilities. The charters were also in English language, which could not be understood by majority of the citizens and lacked contact information for citizen oversight. On maternal, child health and reproductive health services, so there are no major issues pointed out in this area. So in regards to maternal child health and reproductive health services, save for the need to sensitize the public on the Boresha Afya Mama na Mtoto, most of the members of the public had no proper information on how this program, the Otchilo Care program, operates, and that information was not readily available to them. So they felt that they really needed more information so that they can benefit from it. Onto the recommendations of the social audit exercise. So according to the findings, these are some of the recommendations that we put forward in order for service delivery in the health sector to be enhanced in Vihiga County. So one of the recommendations, which has already been acted upon by the county government, is the reintroduction of the Facility Improvement Fund bill in various health facilities within the county. the FIF bill would help to promote efficiency and make services more accessible. Whereas this has already been adopted in the county, however, we need now to move forward and start implementing that piece of law so that these health facilities can actually be able to deliver in terms of the services that they offer. So there's also a need for the county to increase the budgetary allocations for the health services sector to address the gaps for recurrent and development expenditure. Another recommendation that we have put forward is need for the county, through the County Public Service Board, to address staff shortage, retention, and promotion for better service delivery. We have also recommended that the county needs to promote and strengthen engagements by establishing a formal engagement or mechanism platform between the public and civil society on health matters and increase community sensitizations, awareness, for more transparency and better service delivery. For example, maybe through dialogue days or barazas that citizens can engage on health matters. So there's also a recommendation on the need to strengthen capacity on financial management, accountability, and public participation for stakeholders in the health sector, especially management committees and the facility heads. One of the, among the findings was that even some of the facility heads indicated that they did not have proper capacity to manage funds and all that. And also the management committees, some of them did not have proper capacity to engage with citizens. So we are recommending that this one be looked into and so that their capacities can be strengthened to effectively engage with citizens and promote service delivery in the health sector. There's also a recommendation on the need to revise the criteria on selection and qualification for the Facility Health Management Committee members. So this one needs to be looked into as to who is going to be on board in the management committees so that citizens can also be able to effectively engage with them and so that also they can be able to effectively deliver on their mandates. So another recommendation that we came up with is for the need for development of a proper capacity building program for the health management committees by the Department of Health before and during their during their mandates to enable them effectively discharge their roles. So this one has already been, I've already talked about it. So the Department of Health needs to come up with a program specifically to build the capacity of the management committees so that they can be able to discharge their duties and their roles effectively. Our last recommendation in these findings was to do regular monitoring and evaluation of health sector service delivery by citizen groups supported by both the government and non-state agencies. So these were our findings and the recommendations in the report. I would like now just to open the floor. I'm going to stop sharing my screen. I would like to...
Madam, I'm in full concurrence with the social audit that was carried. In fact, most of the aspects that are on ground have been captured in the report. However, I don't know how effective the implementation of the report will be done because most of the issues are touching on the executive, which is supposed to put in effort and facilitate the implementation of the report. Now, my take over the same is that the FIF, that is Facility Improvement Fund, I'm very much concerned on that part because initially we used to have this fund in the facilities whereby minor expenditures with the emergencies could be handled by the facility in charge. But when that was phased out, we have had some problems that could be handled on the ground, being referred to the county headquarters. Also, we have subordinate staff in the facilities who are very important people. Those are the people who sometimes clean, and they are also involved in minor cause within the facility here and there. They were also being catered for within this fund. They cannot be effectively remunerated because that this fund was phased out, and they only depend on the county government executive to release funds for payment to these people. So if actually this fund could be done and effectively be disbursed to the facilities in time, so that the in charge of the facility is empowered to manage and control this fund, then most of the issues that are being hampered by the bureaucracy of the fund to the county.
To make your comments in regards to the findings and recommendations. Kindly go ahead.
I just raised the hand to ask for apology because. Hello?
Yes, we can hear you.
Yeah, I'm saying I've just raised the hand so that I can request for an apology because I'll be leaving for another meeting. But I'm very much happy. The presentations are very good. I know I will get more from my colleagues once the session is over. But kindly allow me because there is another meeting I'm supposed to attend.
Okay, thank you. Faith? Faith Oko, are you with us? Okay, Florence? Florence Martha? Mr. Bulemi, can you hear me now?
Yes, I can get you.
Okay.
Also hear me?
Yes, we can get you.
Yeah, but we seem to be having a network challenges. I'm struggling to follow through the meeting.
Okay.
But we will try as much as possible to keep up. Now,
yes.
Social audit is very well and elaborately capturing the issues that are happening or that are happening. And my only comment would be, first, I want to appreciate the county government for the effort so far, because we tend to realize much of the problem originate from the funding aspect. So partly it may not be possible for the county government to resolve the issue as quickly as possible because you realize the recent challenges with the formula for revenue. However, there are some more of administrative and more local in terms of the budgetary increment once the funds are brought. We will want to encourage Reverend Doctor to pass our communication that it has always been our interest and it has always been our advocacy issue that the health sector's budget be increased. So once the funds are realized in the next budgeting cycle as we are proceeding, we would want more funds to be allocated to health sector so that some of those issues are handled. Thank you.
Thank you so much. I like, is Faith with us? Okay, I'd like to invite Dr. Elisham to provide us with his comments in regards to the presentation that has just been made. Welcome, Doctor.
Hello, Liz.
Yes.
Thank you very much for the elaborate findings that you have shared with us.
Yes.
And particularly also the areas of recommendations that you have put across in tandem with the findings that you have shared with us. I also wish to thank my brother Steve, a friend of mine whom I know as somebody who really fights for the rights of others. I also want to appreciate the comments that Stephen has actually brought about, especially on the issue of touching on improving on the health budget that is supposed to be improved so that the services are actually enhanced. May I also appreciate the issue that Steve has raised, and more particularly on the fever. And I want to appreciate and thank you because you have already mentioned something about it. That is the issue of FIFA, that's Facility Improvement Fund, actually had been suspended at the beginning of the devolution. And some of the problems that we encountered as a result of that suspension is what actually made the Department of Health, being supported by His Excellency, the Governor, we came up with the bill to address the Facility Improvement Fund. And as you rightfully said, I'm glad that it is already now an act, and beginning this financial year, we are now implementing the fifth. That actually means that the money that is being collected by our facilities is supposed to come back and be plowed into service delivery. And I know with these finances with us, we'll be able to address some of the issues that have been raised, including payment of the support staff, and also the issue of commodities, which are actually featured in your findings, will also be addressed. So I want to really appreciate that the issue of Facility Improvement Fund is coming up to assist us. Of course, I know that the level 2 and level 3 are not collecting facilities, but I also know that the funds that will be collected at the higher levels will be able to help us, because these are now the key referral facilities which also need more personnel, more commodities, and also more facilities and infrastructure. So in the long run, I know the availability of this funding, which actually has even a fund manager, we should go a long way in improving service delivery. I would also wish to really commend this social audit that was done, because actually it has highlighted on the key issues that are bedeviling the health services, because we know about 4 areas that are the pillars of service delivery. Number 1 is human resource. Number 2 is commodities. Number 3 is infrastructure. Number 4 is funding, which is actually cutting across. Of course, not forgetting the health information system. And your findings actually have addressed all those issues and areas that are a challenge to service delivery. And I want to appreciate that the findings have also brought up recommendations that need to be done. And what I want to assure you is that as a department, this report is going to be shared amongst the managers of our departments, the CEC, the chief officers, the directors. And then with this information being sharing, we'll be able again to share with the other levels, and particularly even the level at the policy, government policy making, so that the issue of allocation of more funds for the Department of Health is addressed. I want to appreciate that His Excellency the Governor has given a priority to the Department of Health. And you will realize that even during this period of time for the last 3 years, there are a lot that has happened in terms of commodities, in terms of improvement of infrastructure, and even in terms of recruitment of more personnel. Although that is not enough because of the limitation of funds, but I want to appreciate what the government of His Excellency, the Governor, has done for the Department of Health. And I know the recommendations that have been made will go a long way in enhancing the areas that have been pointed out for improvement. I want to assure the members that are on board here, and even other members that are not on board, that will address those issues that have been highlighted in this report, especially the issue of management committees, improving on the delivery of services, because they are key component of service delivery in terms of linking the community and the health facilities, and for that matter, the county government. And I also want to appreciate the role that the civil society are playing, and we want to invite them to always come on board and raise issues that could also assist us to address the issues that will improve service delivery. I know an issue that was mentioned about the suggestion boxes. It is true. What was actually came out as a finding is true. And we would wish to really build on that and make the suggestion boxes in our facilities more meaningful, so that we can use them to also make decisions to improve service delivery. So I want to say on behalf of the Department of Health that we are happy that this kind of audit has been done with a positive objective to assist us as a department to improve on service delivery. And we will be willing to receive any comments, any suggestion, even where issues are not moving in the right direction. The members of the society who are included on this forum today, and even outside this forum, should be free to come and bring their issues and suggestions as to what we can do to improve. Otherwise, I want to say thank you for this audit that was objectively done. And for me, as a person and as a representative of the department, I want to assure you that we will take this report positively and work on it as a department, and also involve others that can assist us to implement the same. Thank you, Liz.
I'd like to invite participants in the forum just to give, once again, to just give us their views and just as a way forward in terms of the findings and recommendations that you have put in herein, so that we can develop an action point moving forward. How do we get these findings and recommendations, particularly the recommendations, to be implemented by the county? Unfortunately, I think Stephen is having a network challenge and we're not able to hear him. And so still I'll invite the doctor again, just from the county executive perspective, or from the county executive position. What are we expecting to see in terms of now implementation of these recommendations that we have given in this report? Dr. Elsham, I'd like to welcome you again, just to get affirmation from the county government and especially the Department of Health on the specific actions that you're going to take in regards to realizing some of these actions that we are talking about. Welcome again, sir.
Thank you, Liz. I am particularly very glad because of what I have been able to learn from this audit, that according to me has been done very objectively, because the issues that are highlighted in the report are actually the issues that are there. So my take as a representative of the department is that I would, in the first place, share this information with the managers of the department. The the county executive committee member for health, the chief officers, and the directors. I think for me, this would be the first thing to share with them, this report and the findings and the possible recommendations. Then the second thing that would happen after I've shared, definitely I know, even if this may not be done in this financial year, some of the issues that are appearing here are the ones that would really be put in an annual work plan so that it can solicit some support from the county coffers. But again, I also want to believe that this report is also going to be shared with the county executive in terms of even the county assembly, because remember, our honorable members are the ones that actually sanction the allocation of funds to the department. And I want to believe that with the report that we have, engaging the honorable members and the county assembly will be one of the other things that will help us use the tool that we already have in terms of the auditor, so that when they are discussing the allocation for the department, they can also be able to look at the key areas that will address the gaps that have existed in the report that has been highlighted today. I also think that the health department actually has a stakeholder meetings. One of the other things that could possibly be done is some stakeholders meeting that we are having in the department. We could also consider to bring on board the members from the civil society who are actually having an interest in ensuring that the members of the public have a right to health. Like the members who are already in this forum today, there will be part and parcel of people we can invite into our stakeholder meetings, so that as they give their views from the public point of view, we can also be able to consider their views and even their opinions, because we also know that quite many members of the community have know how to do some things in the community. And by us incorporating them in our stakeholders fora, then they can be able to make a contribution towards this. So, Madam Liz, I'm saying that one, I will meet the heads of the department to share with them the report. Then the managers can also engage those in the political, what I call, they're the ones who allocate the funds. Then we'll also open up with the members of the community and other stakeholders, so that we can be able to share with them this. And then maybe another thing is we also have some partners in our county who are supporting us in health delivery services. I know there are some other recommendations that could also be considered by the partners who support us. So this will also be another report that can help us to engage partners to address some of those issues. I think that's what I can say for now, my sister Liz.
Thank you so much for the comments. We have noted them, and we'll make follow-ups on the comments that have been made. I'd like to invite my colleagues who are on this platform today, if they have any comments on the report, so that we can take them in also. Alfred, I can see your hand is up.
Yes, madam.
Yes, please.
I was just to raise a concern.
Yes.
So let me thank Mr. Reverend Thomas Ambale because he's one of the medic that he has really been assisting some of these facilities, and he was one person we have been working with for some time, and he seemed very concerned. I'm very happy that he still has some of these factors at heart. My don't know, because I have not gone through the entire social report, especially on the recommendation of the election of the composition of the management committees.
Okay.
Management committees being a link between the community and the facilities. Madam, it was our wish that if you have made any recommendation, or if we are to do any recommendation, then let us also factor in those recommendations the mode of election of those management committees. The time of serving also should be elaborate so that there is no overstay of members of those committees in the facilities, because we have been seeing these things happen. Members are elected and they overstay. It's as if there's no time limit for one to serve in the committee. And then if it were possible, the incorporation of at least a member of civil society in the same, so that we can assist each other within the committees. And if it is possible also, let us also avoid and look for conflict of interest within the membership of the same committee. A person is serving the facility, at the same time, the same person is a member of the management committee. I wonder if that is sometimes an illegality or it is an anomaly. So my concern is just on the composition, election, and the time of serving of the members of the management committees. If such factors were possible, could be factored into the recommendations report, so that they are also looked into, as they will be looking into the matter as pertains the management committees of the facilities. Thank you very much.
Thank you so much, Alfred, for your comments. And they have been highlighted in the detailed report. We'll be able to share with you after this. Those comments have been captured in regards to engagements with management committees. They are very detailed in the report. So I don't know if there's anyone else who has a comment to make before we go to our final remarks. Noted. Mr. Bulemi, I saw your hand up. I don't know whether you have a comment. Okay. So we are coming to the end of our session today. I'd like to make our final remarks and comments. I really want to appreciate us for finding time to join this forum. I know most of the people have been sending me messages that they are having challenges in joining, but I want to thank all of us who have found time and have been able to join and also make contributions towards this exercise. I really want to appreciate the Reverend Doctor for his contributions and participation in this session today. And I just hope that we shall continue with these engagements, because there's more to be done now in terms of just seeing that our recommendations are implemented. And I hope that we are going to have better and more engagements towards a better service delivery in the health sector. I can see my colleague Isabella, your hand is up. Isabella.
Yes, Elizabeth, thank you for this opportunity. Many congratulations for this comprehensive report. I would like to inform the participants that I am putting the report on a link on the chat so we can access it right away. Thank you.
Thank you so much, Isabella. I'd like to invite our Executive Director to make her final comments as we close the meeting. Sheila, you're welcome.
Thank you. Thank you very much, Duya, and congratulations for the report. It's been a lot of hard work, and I think mine is just to comment on some of the recommendations, just trying to look at some of the quick wins that I think the the county, both the county executive and also the county assembly can take advantage of, to be able to at least attain some quick wins. What are the low-lying fruits? Looking at some of the recommendations shared, and I think I've also taken note of all the comments by the participants, including those shared by the Reverend Dr. Elsham Thomas. And I think when I look at some of the recommendations, we should just see how we can then be able to join hands and try and implement, particularly those that do not really entail a budget, budgetary commitment, or will not entail a lot of bureaucracy, because we also understand how the governments operate, both at the national and at the county levels. So, for instance, looking at issues around community sensitization and engagement, I'm just looking at some of the proposals that were able to be implemented in for instance, let me put off my video because I see I have low internet. I seem to have a problem with my internet, but I hope I can be heard. One of the, I remember in a lot of the counties where we have conducted this health sector social audit work, one of the quick wins really has been just to see how we can promote public participation and also engage the communities. And in some of the counties, I remember one of the things that were quickly taken up was the whole idea of the, and I know a lot of counties have this, the community or the citizen action days. So I'm just wondering whether this is something, again, even the county government can take up, just set aside a day or in the week or in the month or in a fortnight basis, where health facilities then have, open up their facilities to citizens, and they're able to come and they're able to find out, get more information from these facilities, and then feel that they're participating in some of the decisions that are being made. I know also when it comes to the budgetary processes, that there's also an opportunity, and perhaps also this is where even the partnerships are really important. How do we build partnerships with between the county government, the county assembly, other county structures, and even other non-governmental organizations to be able to undertake some of these community sensitization engagements, such that when a lot of us are taking up these public forums, community forums, then we're able to include information in regard to health, and even invite the county health officials to be able to participate. It's the same idea again with the capacity building, strengthening recommendation, where we can also see how we partner with other organizations to be able to deliver and support in terms of county capacity building, particularly when dealing with the health facility management committees and so on. I think also on the aspect about access to information, I don't know whether Vihiga has an access to information law, but I know that there's a model county access to information law that has been developed by the Commission on Administrative Justice for counties. But even in the absence of a law, we already know that the Constitution gives us the right to information, and there's a law in place at the national level. And just trying to perhaps see how proactively, I think it's just a matter of getting a system in which the county government is able to publish proactively information to citizens. We've talked about, even the service charters. As you look at the report, the service charters in all the facilities lacked some basic information regarding services offered and so on. And I think a basic place to start would be just on the service charters. What language is being used so that it's able to be, wananchi are able to understand. Should we use Maragoli or Kinyore to be able to explain what is in those service charters, or Kiswahili? So I think there are simple ways in which some of these things these recommendations can then be able to be taken up without even necessitating, any let me not say not any budgetary support, but with minimal budget support, perhaps just working through partnership with organizations that are already, on the ground supporting health work. But I think at the end of it, I just want to say thank you once again to everyone who made this social audit possible, and the Elizabeth and the team that you worked with to go to the ground to be able to undertake this work. And I think it's a very, very good report. And I hope that you'll be able to read it. I think the link, Isabella has posted the link, but then we do look forward to further engagement so that we can actually bring these recommendations to fruition. And thank you very much for just sacrificing your afternoon to be with us so that you can be able to share the findings of this report. Thank you.